We begin this hour in Washington, where some top U.S. officials are taking extra precautions today after multiple people who work inside the White House tested positive for the coronavirus. Weijia Jiang is following all of this for us, and she is joining us now. Weijia, a couple of things that I want to bring to light here. The president tweeted just a short time ago that the coronavirus numbers are looking much better, going down almost everywhere. Big progress being made, but it seems that the numbers are going up in the White House. What can you tell us about the staffers that have tested positive and about Vice President Mike Pence?
Well, we know last week that one of the president's personal valets, this is a member of the military who serves him meals, tested positive for the virus. And then on Friday, the vice president's press secretary, Katie Miller, also tested positive. Now, she's not just, handling communications for the vice president. She's also married to Stephen Miller, who is one of the president's closest advisors, the architect, if you will, of the president's hardline immigration policies. And so these are people very close to the president in his orbit who have now tested positive, begging the question, who else might be infected with this virus and what precautions they can take. Now, I can tell you that President Trump and the vice president are not self-isolating. Both are expected to be here at the White House today. And, they are taking some other measures, but nothing really significantly different in light of these developments, which are important because when you start talking about people close to the president being exposed and potentially carrying the virus, it is very serious. I will also mention that on Saturday, the head of the National Guard tested positive as well right before a meeting with the president and other military officials, and so he was actually not allowed to go to that meeting. Later on, he had a second test which came up negative, which raises some more questions about how reliable these tests are, but the bottom line is he did test positive at one point, and so that was another close call for President Trump.
Yeah, I believe when it comes to these tests, I believe I heard that they could have like a 15% false negative. But I'm curious about what was being done prior to this recent disclosure of all these people testing positive to ensure that COVID-19 didn't infiltrate the White House, and then what changes, if any, are they making now?
So before you can even enter the grounds, you have to get your temperature taken. And now members of the White House medical unit also ask us things like, what kind of symptoms have you had in the past 48 hours? Do they include fever, coughing, the other symptoms related to COVID-19? And, before, everyone who was going to be in close contact with President Trump was tested on a weekly basis. But now that is ramped up to a daily basis. So we know that for officials here, they're being tested more. But other than that, there are other things on the table that haven't been implemented yet. For example, masks. And the reason why masks are important is because the White House has said the reason why the president and other staffers are not wearing masks and no one is required to wear them is because they only are meant to protect others from contracting the virus if you have it. And so wearing a mask, they want to stress and always have, will not protect you from getting it, but if you already have the virus, it could keep you from spreading it. And they say it's not necessary because, the president and these officials are tested so often, and because they know that the tests are negative, they don't have to wear masks as an extra precaution. But as we just talked about, Anne-Marie, these tests are not perfect. They have a high, rate of giving a false negative between 15 to 20%, and that is substantial. And so, it's unclear why the president does not want to embrace mask wearing, but we do know he has said before he doesn't see it for himself. He cares a lot about optics, so it seems like he just doesn't want to wear one because of, what other messages might be delivered from having a mask on his face.
But Weijia, here's the question, and I know that you tweeted earlier this morning that the president will be holding a press briefing later today, and you have a lot of questions for him. A question that I would have is, The optics. So here is the president of the United States not taking the precautions that his coronavirus task force is recommending to the American people. Here is the president of the United States talking about a transition to greatness, urging governors to reopen their states, even if they have not yet met the CDC recommended guidelines for reopening their states. And so in the White House, in the West Wing, because of those factors, you are seeing the coronavirus infections hit members of the administration that are near to the president of the United States. So about the optics, if the American people are being told that they should go back to work, that they should go back to restaurants and movie theaters and sporting events, and the West Wing itself has become a hot zone, the optics of that are in the West Wing, where, as you said, Weijia, they are tested every day. Those Americans out there in this country do not have access to that level of testing. And even in the White House, where people are being tested every day, they are getting infected with the coronavirus. I wonder what you're hearing from administration officials about the optics around that.
You know, I think those are all extremely important questions, and I think there's a hesitation to really lean into talking about that too much, because there's a lot at stake here. And those are questions for President Trump, because it is President Trump who has resisted widespread testing for the country. It is him that is, driving the messaging, even though he has an entire team. He is the communicator in chief. And we know that he cares a lot about presenting this sense of normalcy to people and wanting to urge them to get back to work to try to salvage what's left of this economy that he built and he feels was, unfairly ripped away by this pandemic. And so he clearly has set his priorities on reopening the country. But your points are so valid, Vlad, because when you're asking American people to do their part, to get the country back up and running, and you're not giving them the tools that are required, how can you ask them to sacrifice their own health? Of course, the president would say that the U.S. is, in fact, doing everything it can to provide testing, and they're very proud of the numbers of tests that have been conducted so far, which is about 8.5 million, and that's still less than 3% of the population. And the administration always says, look, we're doing better than any other country with regard to testing. We're doing more than anyone else. But who cares? It's hard to understand why the president is framing this as a competition against other nations when we know it is a competition against the virus, one that Americans continue to lose every day because people are still dying. And regardless of what the president says, the number of cases continues to rise.
So listen, Weijia, moving forward, Dr. Fauci as well as other top health officials are going to be appearing before a Senate committee via video to talk about this whole thing, about the response to the coronavirus. So perhaps we'll get a little bit more clarity. I know that Dr. Fauci is on a partially sort of isolating himself or quarantining himself because of the news of all the number of people who tested positive in the White House. What can we expect from the meeting tomorrow? What are lawmakers hoping to hear?
So first, I think it's interesting to point out that at one point, a couple of these top members of the task force were going to appear in person before this Senate committee, and the plan was to do that wearing masks. But then, I think as this story simmered even more over the weekend, they decided to do that remotely, that would, probably present a better message, that they're leading by example and they're not going to come in contact with other people since they have been exposed to someone who tested positive, and that is the vice president's press secretary. As to the content of the hearing, I expect a lot of questions about when they knew what and what they did in response. So I think crafting a timeline will be really critical. And a lot of questions still remain about the administration's response, because we get, these sort of answers in the can from the president and from those around him. But these are the people who were sending the warnings and the people who were studying what was happening in China. So they'll have a lot more details about, the nitty-gritty of what was done when and why, and what wasn't done for that matter, during their appearance with lawmakers tomorrow.
Yeah, it should be really interesting. Weijia Jiang, thank you so much.
Thank you.